Hi everyone, welcome back to my YouTube channel and today we are going to talk about bacterial infections. So let's start our topic with introduction. Bacterial infections are illness caused by pathogenic bacteria, which are microorganisms that invade the body, multiply and produce toxins or induce immune response leading to disease. They can affect any organ or tissue, ranging from mild skin infection to severe systemic illness like sepsis. Bacterial infections are among the most common causes of morbidity and mortality worldwide, but many are preventable or treatable with antibiotics and proper hygiene. Definitions of bacterial infection. A bacterial infection is defined as a disease state caused by pathogenic bacteria, resulting in tissue damage, inflammation, and range of clinical symptoms depending on the site and severity of infection. Classification of bacterial infection. Bacterial infection can be classified based on different criteria. Based on duration, the infection may be acute or chronic. Acute infection is rapid onset and short duration, while chronic bacterial infection is a persistent infection that may last week or month, like tuberculosis. Based on site of infection, infection may be localized infection or systemic infection. Localized infection is an infection that is restricted to one area, like skin abscess, while systemic infection is the infection that affect multiple organs or the entire body, like septicemia. Based on type of bacteria, bacterial infection is gram-positive infection and gram-negative infection, and also acid-fast bacterial infections. Gram-positive infections are caused by bacteria with thick peptidoglycan cell walls. For example, Staphylococcus aureus or Streptococcus pyogenes infection. Gram-negative infection is caused by bacteria with thin peptidoglycan wall and outer membrane. For example, Escherichia coli and Salmonella infection. And acid-fast bacterial infections are caused by bacteria like Mycobacterium tuberculosis. Etiology of bacterial infections. Bacterial infection can arise due to pathogenic bacteria like microorganisms that are capable of causing disease. Opportunistic bacteria that are bacteria that are normally harmless that can cause infection when immunity is compromised, like Pseudomonas in hospitalized patient can cause infection. Third etiology is contaminated food or water that can lead to gastrointestinal bacterial infection. Fourth etiology is direct contact or inhalation that can cause respiratory or skin infections. And common pathogenic bacteria include Staphylococcus aureus that can cause skin infection and pneumonia, Streptococcus pyogenes that can cause streptococcus throat and rheumatic fever, and Escherichia coli that can cause UTIs, and Mycobacterium tuberculosis that can cause tuberculosis, and Salmonella species that can cause foodborne illness. Pathophysiology of bacterial infections. Bacteria enter the host through cuts, inhalation, ingestion, or mucous membranes. They adhere to tissue using adherence and multiply. Then bacteria produce toxins that may be endotoxins or exotoxins that can cause tissue damage. And then the immune system responds with inflammation, fever, and recruitment of white blood cells. In some cases, bacteria evade the immune response, leading to chronic or systemic infection. Clinical features of bacterial infections. Symptoms depends on type of bacteria, site of infection, and host immunity. Common features include fever and chills, fatigue and malaise, localized pain or swelling, in, for example, abscess and cellulitis, redness or pus formation, gastrointestinal symptoms if GI is involved. In case of diarrhea and nausea and vomiting, these symptoms may happen. Then there may be respiratory symptom if respiratory system is involved like cough, dyspnea, sputum production, and severe bacterial infection may lead to septicemia, organ failure, or death if untreated. Diagnosis of bacterial infection. First we can do is clinical examination, that is assessment of symptoms and sign. History of exposure, travel or trauma is taken. Then we can do is laboratory test in which we can do microscopy for gram staining or acid fast staining. We can do culture of blood, urine, throat swabs or wound swabs. We can do serology to detect bacterial antibodies or antigens. We can do molecular tests like PCR for rapid identification of bacterial DNA. Then we can also do imaging, and it is used for deep infection like abscesses, pneumonia, or osteomyelitis. Management of bacterial infections. Management depends on type of bacteria, site of infection, and severity. We can give antibiotic therapy, that is a selection based on culture and sensitivity. Common antibiotics for bacterial infections include penicillins, cephalosporins, tetracyclines, macrolides, and fluoroquinolones. Duration of antibiotic therapy depends on infection type. Short course for mild infection is given and long for chronic or systemic infection is given. Supportive care in case of bacterial infection includes hydration, nutrition, and fever management. Reset and monitoring for rest and monitoring for complications are then we can also do is surgical intervention that includes drainage of abscess or infected tissue if necessary. And we can also prevent bacterial infection by vaccination. For example, vaccination for tetanus, pertussis, or pneumococcal vaccines. We can prevent bacterial infection by proper hygiene and sanitation. We can prevent bacterial infections by safe food and water practices and by timely wound care. Complications of bacterial infections may be sepsis or septic shock in severe systemic infection. Organ destruction may happen in and chronic infections may occur like osteomyelitis and tuberculosis, and antibiotic resistance may develop due to improper use of antibiotics. Prognosis of bacterial infection. Most bacterial infections are treatable with timely antibiotics. Prognosis depends on host immunity, bacterial virulence, and site of infection. Early diagnosis and proper treatment prevent complications and reduce mortality. Conclusion of this lecture video. Bacterial infections are caused by pathogenic or opportunistic bacteria that invade the body, multiply, and trigger immune responses. They range from mild localized infection to life-threatening systemic illnesses. Early recognition, appropriate antibiotic therapy, supportive care, and preventive measures are essential for effective management. Awareness of bacterial infections and hygiene practices help reduce incidence, morbidity, and risk of complications. And this was all about bacterial infections. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.